So thank you everybody for coming. I'm Helen, I'm the Chief Executive at the Money and Mental Health Policy Institute. We are so delighted to have so many of you here this morning and for bearing with us when we had to move this event online as well. Although it was a shame not to see you in person, it's meant that we've actually got a lot more people joining us this morning than we would have been able to have in person. So I'm really pleased that more people were able to come along. For those of you who don't know us, the Money and Mental Health Policy Institute, we're a research-led organisation, and we're here specifically to try and understand and help tackle the link between financial difficulty and mental health problems. For those of you who are more familiar with us, you'll have heard me say before, you are 3.5 times as likely to be in problem debt if you're living with a mental health problem, and half of people in problem debt have mental health problems. So we're here as an organisation to understand why that is, and most importantly, to try and tackle it at every level, from working with mental health services, employers, government, the benefits system, through to the work we're focusing on today, which is with essential services and at times with regulators as well, to understand how we can make sure that people with mental health problems are not disadvantaged when they're using essential services, and that those services don't have a detrimental impact on the mental health of anybody who does use them. At Money and Mental Health, all of our work is rooted in the lived experience of people with mental health problems. We run a research community that is a group of nearly 5,000 people who all have experience of mental health problems. And their views, their experiences, their policy ideas are genuinely at the heart of everything we do as an organisation. And today's work is absolutely no exception. About 4 years ago now at Money and Mental Health, we published some research informed by that research community that showed some of the huge challenges that people with mental health problems can face when they're choosing, using and paying for services like banking, telecoms, water, energy, broadband, and particularly at the moment in the cost of living crisis, the financial difficulties that people can be facing as well. But in terms of those challenges, so we found, for example, people with mental health problems were 3 times more likely to experience significant anxiety when they're dealing with essential service providers. 1 in 5 had panic attacks as a result of talking to essential service providers. So we set out on a piece of work to understand how could we work with firms and regulators to make sure that people were having better experiences and crucially getting better outcomes from those essential services that we all rely on for our day-to-day lives. And this led us over the last few years to really focus on the idea of inclusive design. So for those of you who are less familiar with it, the most common example is the dropped curb. So people in wheelchairs struggling to get up and down off the pavement. Instead of adapting wheelchairs as a society, we drop the curbs on the pavement, which has an added benefit for everyone who uses a walking stick, a pushchair, has a suitcase. And that's an example of inclusive design. You design systems and processes that work for people with additional needs, and it has the added benefit for everyone. So we've spent the last 4 years talking to firms about what inclusive design means for people with mental health problems. If you struggle to open the post, how we can make sure that you're getting essential messages. Half of people with mental health problems struggle to use the telephone, but 1/3 of all of your customers struggle to use the telephone. So if we can make sure that essential systems are accessible without going through that route, you don't just benefit your customers with mental health problems, you benefit all of your customers, and your business as a whole is probably going to get better outcomes. So why today are we talking about disclosure? Because on the face of it, those two things feel like they're in opposition. If we design systems and processes that work for everyone, regardless of who they are, do you even need to know what people are going through? Well, sometimes you do. So it may be that somebody needs to ask you for something that you aren't able to offer to all customers. It might be that there's some additional support that you need. And so being able to have an honest conversation with a provider to say, this is the reason why I can't manage my bills this month. This is the reason why I can't open the post. This is the reason why actually your call center is really inaccessible to me, and these are my additional needs, can be really transformative. And also because if we're honest, there's still a long way to go on inclusive design. We don't have fully accessible essential services for people with mental health problems at the moment. And so we still put more onus on individuals to tell us what their needs are so that we can then try and accommodate them rather than always anticipating them as best as we could do. So today's piece of work is an absolutely crucial piece of that puzzle. And I am so delighted to be working with Chris and Dan and with the Money Advice Trust on this. We are kind of really proud to have come together with such experts, and the guides today are going to look at the full experience of what a really good, meaningful disclosure looks like for somebody with mental health problems and for a firm, and how to make it work for both parties in a way that means that customers are getting better outcomes, which is what we're all looking for. And this is all the more important in the light of the cost of living crisis that we're going through at the moment. Our research is already exposing people who are struggling at the more severe end of mental health problems as a result of the cost of living crisis. People who are feeling suicidal, people who are really, really struggling at the moment. The more we can enable people to tell you, the more likely it is that we're able to get help and support to people when they need it. So this has never really been more important. The format of today's event is relatively straightforward. We're going to kick off with some opening presentations from our report's co-authors, followed by a short breakout session. We were really sad when we had to move this online because I was really looking forward to seeing some of you in person. And I know that our events always have the added benefit when they're in person of bringing together people who don't see each other very often, different sectors, connecting the mental health worlds with financial services, energy, telecoms, those of you coming from different industries and fields. So we thought we would stick in a short breakout session. It's not very long, but hopefully it will be an opportunity for you at least to meet some of the other people on the call and have a conversation about some of the issues that we're discussing. Then we'll come back for our panel discussion, and there'll be plenty of time to ask questions as well. Please do put questions in the Zoom chat box. We will deal with them all when we get to the Q&A session. So if you're asking questions during the presentations, we will pick those up as well. I should also say that live captioning is available. You will need to turn that on in Zoom if you use it. If you're not sure how to turn it on, please do just pop a message in the chat and a member of our team can talk you through how to do that. We also like to do a poll in our events at Money Mental Health because I'm always interested to know what you're thinking, and we have so many experts that come along to our events that it feels like a shame if we don't take a bit of a temperature in the room. So today's poll will come up in a minute on the screen. And we're going to be asking you, what is the biggest challenge that essential service providers face to improving disclosure? We're giving you 4 options. I'm sure you will think that a number of them are a challenge, but if you could give us a vote on which one you think is the most pressing one for you or your organisation at the moment, we'll then have a discussion about that in our breakout rooms. You can move that little box with the poll to the side off the window. So if you want to think about it for a little bit, feel free, and we will come back to the answers to that after our presentations. And just as a reminder, we are recording today's session so that we can play that back for people who aren't able to make it live. I'm really pleased that doing the event online does make it more accessible like that. We won't be recording the breakout session, so anything that you stay in there is just for those people who are in your breakout session. Fantastic. I think that's all of the housekeeping. I don't have to tell you about fire escapes. Hopefully you know where they are in the building that you're in. We're not expecting any fire alarms to go off. So I'm going to hand over to Chris Fitch, one of our co-authors for the first presentation. Many of you will already know Chris. Chris is the vulnerability lead at the Money Advice Trust and a research fellow at the Personal Finance Research Centre at the University of Bristol. Chris was previously head of policy and research at the Royal College of Psychiatrists and a researcher on international and national public health interventions at Imperial College Medical School. To date, Chris's current programme has undertaken work on consumer vulnerability with more than 350 firms and 35,000 staff. Chris, I hope that you're keeping an actual tally of that. It's a very impressive number. And across financial services, broader essential services, retail and government. So, Chris, I'm going to hand straight over to you. Thank you for joining us.
Lovely. Thank you very much, Helen, and thank you to Money and Mental Health Policy Institute for the partnership with Money Advice Trust. But most importantly, thank you to the participants in the research that we're going to be sharing with you this morning. So what I'm going to do is tell you about the 3 new guides that we've produced. I am only going to be able to give you a selection of the messages. You'll have to read the full guides to see exactly what's in there in terms of depth and detail. But I think the place to start with this is that obviously disclosure is a very well-known and established pillar of vulnerability strategy. So whatever your sector, and I picked a few out here in terms of the regulators, it's in the regulatory expectations and approach, and it's probably to differing degrees in your own firm or organization's approach. And if you're a consumer, if you're someone living with mental health problems, you'll be relieved to know that at least the sectors are thinking about this actively. However, disclosure is not without challenge. So the way in which we signal at a regulatory level that something should be done about it might seem simple on paper, but actually it can be a challenge both for consumers about whether they make the difficult choice to disclose and what that then involves afterwards, as well as firms and as staff in terms of actually dealing with disclosures, whether they're delivered via mail, via the telephone, or over digital. We've got case studies from them in all the guides. There is always a challenge. Now, that said, and this is why I'm so pleased that we've got the 3 guides today, there's been very little research on what actually happens and works in practice when disclosure takes place. So we talk about disclosure quite a lot, but actually what takes place when it happens. So we are presenting today some new data, qualitative data, from interview studies with 34 participants, frontline staff, leadership and debt collection firms, and people with experience of mental health problems and debt. We've chosen debt collection. It could be any other aspect of a business, but we've chosen debt collection because that's often where disclosures occur. And that's supplemented by some data from a quantitative survey, 5,000 participants that Money and Mental Health Policy Institute undertook back in 2020. So it's a mixture of the new data and some existing data that we've taken another look at. So what I'm going to give you is some selected highlights. So the first guide, I want to pick out 2 messages here. The first guide is all about encouraging disclosure. And I'm going to pick out 2 messages in relation to the barriers to disclosure, what stops people telling organizations about their mental health problem, and also what we're calling pathways to disclosure, the ways in which firms can encourage that disclosure and create a disclosure environment. And in the guides, and you can see at the bottom of the screen, there are a number of barriers and a number of pathways, but I'm just going to pick on 2 key messages for you. The first one is that actually it's still a minority of consumers who disclose. Now, clearly some people may not disclose because they're unaware that they have a mental health problem. Some people may not disclose because the design in terms of inclusivity is good enough. It's already anticipates and prevents their problem from occurring. So there's no need to disclose. There's no relevant need. However, we're only getting a minority disclosing, and it's still the same barriers that we're seeing again and again. So if we look back at some of the work Money and Mental Health has done in the past, much of that is reflected in the barriers that people are here today. And I think that's worrying, given the gap between when the Money and Mental Health Policy Institute research in control or taking control back, I think in 2016, came out. There's been some additional work in between. There's a real fear of harm. People are very worried about what will happen if they disclose. And there's also a sense that it's not worth disclosing. What's the point of it? And that's coming through very, very strongly in our interview. So something for us to really consider in our breakout groups is that fear and that sense it's not worth it. Now, some firms are acting. We've got case studies on all the guides, and guide 1 from Barclaycard, Lloyds, and Phoenix Group and Cowrie. And the 2 things that seem to be cutting through is the support and signals. So the way in which firms signal to consumers that there is something that can be done in terms of support if they do disclose, and giving people opportunities to disclose. And one of the things that we're most excited about, and you'll find this in guide 1, is actually a flow chart, a pathway, whatever you like to call it, around encouraging disclosure at the earliest possible point, from pre-application, and not application itself, because people are not going to tell us these things, but also during the onboarding stage as well, and then routine contact. So building pathways to disclosure. Guide 2 builds on this. Now, Guide 2 is all about responding to disclosure. And we've asked the question here, what makes for a good disclosure? And it'd be fascinating to know what the other panelists and yourself make of this. And again, for our interviews and our research, we've identified a number of issues ranging from action and transparency down to choice and control and organizational culture. But I want to give you 2 messages here. And the first message I want to give you is that there are tools out there that firms use for managing and responding to disclosure, and they're great, but they're not enough in their own right. They provide a framework, but as one interviewee, a leadership in a debt collection firm said, actually at some point you've got to take the stabilizers off the bike. You always have something that's disclosed, a situation that just doesn't fit. So the tools are not enough. So what we're looking for are the things that people do, staff do in response to disclosure outside of those tools. And the first one that shone through was action, showing that firms actually thought not just about encouraging disclosure and responding to it, but actually having support in place. Sometimes they call that treatment strategies, but support or help in place to actually assist the customer and meet their needs. The second thing that really came through, and this will be a challenge for digital, but it came through very strongly in relation to telephone disclosure, was a sense of connection, so engagement with that member of staff that they understood. And then the second message I wanted to get across, that key message, was what makes for good disclosure is actually a recognition that disclosures come in many different types, and the guide lists 8 different types of disclosure, ranging from accidental down to bundled to cautious to third party. And we're seeing firms like Capital and Monzo, who have case studies in the guidance, who are responding to this in a flexible manner across their channels. Now, the last guide to wrap up is around recording. It's the most complex of all the guides, but I think what's really important for us at Money and Mental Health and the MoneyWise Trust is this is actually the first time we think that consumers have been asked not just about what should be recorded, but actually the degree of control and choice they have over what is actually stored and processed by firms on their systems in relation to disclosure. And the consumer voice is often overlooked. If you think about debates and discussions around data protection, often they're very technical, they're very complex, and they're often, if I can put this to you, focused on what's possible for a firm to do, what's operationally possible, what can we do in these circumstances? And that often overlooks what consumers want recorded and how they want it recorded. And one of the key messages that came through, our first key message out of 2, is choice and control, a real strong sense that it's my data, it's my information, it's my choice if I share that with the company. So this is really very, very strongly emphasized in Guide 3. However, we also put to consumers a number of different situations because we recognize that there are multiple ways in which firms can record this information, their approach. We gave them situations where they may be given an explanation how a firm might record their data, but no choice over whether it's recorded, where they might receive an explanation, a form of choice, and then whether they might be given an explanation and an opportunity to object to that data being recorded, but that could be overridden, which some of you be aware is one of the lawful processing bases under the Data Protection Act. And I'll come to that in a moment as I wrap up. And very strongly coming through was a sense that actually it is my data, it's my choice, it should be my control. I know what's in the best interest for me. So there's a job here to be done if firms are thinking and moving away from explicit consent to other lawful processing bases to ensure checks and balances and an explanation is given of how this actually takes place in practice. So I hope I've whet your appetite there for the guides, the 3 guides that we got. And I think the key message to take from it really is that disclosure is a central pillar of any vulnerability strategy. We know this, but whether we're responding or encouraging disclosure or recording disclosure, we really need to better unpack what happens and what works and ensure that the voice and experience of consumers with mental health problems is at the center of this. Helen, thank you.
Thank you very much, Chris. That was fascinating and also brilliant to get such a whistle-stop overview of such in-depth work. So please do have a look at the full guides. They are intended to be really practical guides that you can just pick up and use within your organisation. But Chris has given you a really good overview there. I'm going to go over now to Conor. So Conor Darcy is the head of research and policy at the Money and Mental Health Policy Institute. So he's responsible for planning and delivering all of our research and policy work, and crucially using the insights from that work to help develop solutions to break the link between mental health problems and financial difficulty. Before joining us at Money and Mental Health, Conor worked for the Ministry of Housing, Communities and Local Government and spent most of his career in the third sector with roles at the Resolution Foundation and the Joseph Rowntree Foundation. Conor, I'm really delighted that you're going to be giving us a bit of an overview of particularly some of the regulatory context that these guides sit in. So I'll hand straight over to you.
Great, thanks very much, Helen. I'll start first, but I think by echoing some of the things that you said at the beginning about why this issue matters so much and why we care about this at Money and Mental Health. And I think that link between financial difficulty and mental health problems is just something that we hear so commonly, that the toxic cycle that it often ends up being, where when your mental health affects your finances, and when your finances affect your mental health. It's just is basically why we exist, and it's driven our interest in this work. And that stat of people with mental health problems being 3 times as likely to be in problem debt as the rest of the population, I think really sets up why there's such a big opportunity here for firms when they can get it right, get disclosure right, to get that support to people, which can make a really powerful difference. It's a long-standing issue. It's not brand new, but I think the cost of living crisis really has, upped the potential benefits that can come to individual consumers as well as to firms from getting this right. So some polling that we did earlier in the year, we found that people with mental health problems were more likely to have borrowed money or to cut back on essential spending in response to the rise in the cost of living. And I think that's really important to, both because it can suggest that people are going to be struggling financially that bit more if they are, having difficulties with their mental health. But again, going back to this point on the cycle, if people are making those really difficult decisions about cutting back on, heating, or cutting back on the number of meals they have. We also heard from lots of members of our research community who were missing, say, medical appointments because they couldn't afford the transport to the GPs, say. That's not going to be very good for people's mental health. And again, it just exacerbates this cycle. So I think the potential opportunity of getting disclosure right now is just bigger than it's ever been. I just wanted to bring out some of the reasons from our research community about why this is such a challenge for so many people, why people don't feel like sharing this information. And again, going back to Helen's point, disclosure is never going to be the complete single silver bullet to all problems that people with mental health problems face in using and getting the most out of essential services. But there are lots more things that could be done to help people get to the support that is available. I think this issue of prejudice came up a lot, and I think there's a lot of, from people who hadn't ever disclosed, that this was one of the big concerns. They just felt like anytime they share their experiences of mental health problems in day-to-day life, often they were getting quite negative feedback. And we also did hear from people who had disclosed and felt like they weren't understood, they weren't listened to, and why all the points that Chris mentioned there about the response, why that's so important, I think is really comes through from that quote as well. I think this question around enough knowledge that staff actually understand the practicals of how a mental health problem can make it harder to stay on top of your finances, to understand key information. I think that was a really common point that we heard from our research community. And then again, going back to the importance of the data question, people were concerned about who would have access to the information that they were sharing, what it would mean for their ability to get a credit card, to get a loan in future, is something that we really do hear a lot. So lots of those were kind of based on people's concerns or fears. But we did also hear from people who had gone through the process of disclosing it and had a bad experience. So this person was speaking about not having a positive experience. And I think, again, the fact that this is potentially an open goal for firms is really hit home by the second quote, where they said they don't disclose mainly because they never, firms never ask or provide an opportunity for me to do this. And if they did ask in a way that was supportive and open, I would probably tell them. So while you're never going to get absolutely complete disclosure from every member of your consumer base, there is still a really big opportunity for lots of people who, like this, are open to doing it if they're given the right opportunity and that's presented in the right way. So as Chris said, I think there's loads of good regulatory reasons to do this. The FCA has been very keen on this, and the consumer duty particularly, I think will make this more important than ever before, that firms are demonstrating that they understand their customers. It's going to be really important for Ofgem as well. Ofwat are introducing a new consumer-focused principle. So there's good reasons for firms to do this from a regulatory point of view, as well as from what consumers need and what they benefit from. Again, just to bring home the difference that this can make to people, and I think Dan might talk about this a bit as well. When people did disclose and they shared the positive experiences, it was really powerful when people spoke about the member of staff they were speaking to slowing down, offering to go over anything again and answer questions, leaves that really positive impact on people. And again, going back to this point around data, that if someone's supportive, asks permission to make notes on their file, having dedicated teams, when these sorts of supports are got to people, it really can be transformative. So again, just to quickly run through some of the key findings, there is loads and loads in the report. And as I said, there's no single solution for this. So firms really need to be thinking across the board about what they can do. And again, I'd be really keen to hear how firms are kind of getting on with this to date. But that proactive encouragement that Chris mentioned, I think is so important, not just thinking it's a one and done thing. You need to keep mentioning it all the time and in routine kind of comms that get out there, and being really clear on what support is available and what sort of difference it would make. I think the main thing that we heard from people with mental health problems who hadn't disclosed was that they didn't think it would make a difference, that there wasn't something that would be offered that would actually improve their experience or their ability to stay on top of their account. So explaining what you can do and how it would make a difference, I think is a really big opportunity. Responding well, I think, is so important. And some of it comes down to pretty basic things around being empathetic and reassuring. But I think from what we hear, there's still a bit of a way to go on that. Actively asking and listening, not just assuming that everyone with a mental health problem has the same needs or would benefit from the same thing or needs to be treated in the same way. That was a really big one. And then actually following through with the support is just massive, because if people are disclosing and then not getting the help that was promised to them, it's obviously a big missed opportunity. And then lastly, around that recording of disclosure, I think making sure that staff really understand how data will be recorded, used, and shared after disclosure is a big part of it, but to make sure that information gets clearly across to people, so that when people with mental health problems have disclosed, they can feel confident that that was the right thing to do, that it has benefited them, and that's something that's going to stand to them and is something they would choose to do again in the future. So that's it for me.
Thank you very much, Conor. I'm going to move us straight on to hear from Dan now. So Dan is our third co-author on this report. I've had the pleasure of introducing Dan at a few events in the past, and I have to say, I think they probably have the most impressive bio of anyone that I've ever read out. So bear with me while I read this one out. So as well as being co-author of the guides, Dan is a disability activist, co-convener of the Futures Thinking Network at the Oxford Research Centre for the Humanities, CEO and founder of Rogue Interrobang, which is a spin out of the University of Oxford. Dan is also the 3 times Creative Thinking World Champion, 3 times European Speed Reading Champion, former World Intelligence Champion, and is a regular speaker on all things creative, as well as an interdisciplinary lecturer. And perhaps most impressively, they are also a member of the advisory board of the Money and Mental Health Policy Institute. Dan, we're honoured to have you. I'm going to hand over to you to respond a bit more to the guides and your involvement in that as well. Thank you.
Thank you. Apologies if I crack up a little bit. It was the flu jab this year knocked me back, so I am still recovering from that. So apologies to everyone. So yes, I've lived with bipolar disorder since I was about 15, and ADHD and dyspraxia all my life. And this means there are things I find very hard or impossible that others find inconvenient at worst or often don't notice. So although I won the World Intelligence Championships a couple of decades ago, I struggle to process even simple information through some forms of communication, like phone calls. And although I compete in memory championships and could memorize a deck of cards in a little over 2 minutes, I struggle with working memory so much that if I don't write something down I need to do in the single journal that I keep, here it is, the moment someone tells me, that task will actually just be gone from my mind. So this makes it almost impossible for me to access many essential services, whether default communication is by phone, where I have to use multi-factor authentication to access vital documents or account details, or when a task has multiple stages involving switching between screens or collecting information from different sources. And it's this spiky profile that's one of the roots of my struggle with disclosure. Because I was good at exams growing up, I wasn't ever given the help I needed with the many things I struggled with. At best, I was told I was bright, I'd be fine. At worst, I was told to shut up and stop taking attention from the people who really need help. And that kind of thing stays with you. It makes it a very big step to ask for anything ever again. It's the kind of story that many of us have, and it means when we come to someone for help, when we finally ask, we can be in a desperately fragile position. That's just one reason why it matters that our disclosure experiences are good. By improving disclosure environments, firms could slowly help heal that trauma, reduce the anxiety, give us back some of our precious and scarce resources, and start us on a path to a situation where conversations with our financial service providers take no more from us than they do from anyone. Sadly, that's too often not how it goes. So I've explained the things I need many times to institutions and individuals whose help I needed to access things other people take for granted. And many times I've chosen not to. Too often the outcome has been the same in both cases, and that's something we've already heard. And that's part of what I want to spend a little time explaining, how these poor outcomes in the past shape decisions in the present. Because it's only by understanding this relationship that firms can understand how to take the first step to break that cycle. And it's only by understanding how deeply those decisions are rooted that they can understand that to break the cycle, they have to take the first step. So the first kind of poor disclosure experience I've had has been the one that makes no positive difference in practice. The only impact is the negative one of leaving me feeling wrung out and disillusioned. Sometimes because the firms I've been dealing with simply haven't listened, when you feel as though your voice counts for less than other people's at the best of times because of the way society treats you, this is particularly frustrating. So one example is beginning a web chat with my bank to ask about changes to the way my statements are sent out, only to be told at the crucial moment that I would need to migrate the conversation to a phone call. I explained the phone wasn't accessible to me because I struggle with auditory processing. And I was literally told, yes, they understood, they were here to help. They could sort that out if I just called the telephone helpline. There have also been times when firms haven't been able to help for a very good reason, such as regulation. But instead of being transparent about that, they have, for want of a better word, simply ghosted the request. So when my spouse was the victim of fraud, what would have taken 2 minutes to sort out on a telephone call took us 3 months to fix. In the process, I ended up taking 2 days of annual leave and visited a branch to obtain a mailing address to which we could outline the fraudulent transactions which we sent at our expense, recorded mail, and which was never acknowledged. My spouse then received a demand letter for the payment of the fraudulent balance. And finally, I lost a week of meaningful life having to prepare a script so I could use the telephone and place the mouthpiece next to my autistic spouse, who was unable to speak and cannot process remote spoken words in real time, while the helpline person read out a long list of privacy policy notices that they promised they wouldn't, and my spouse could make a noise that they accepted was permission to speak to me, thereby basing their gathering of consent on the one scenario in which my spouse was actually unable to provide it. Every single time we sent email or written communication, we asked to be able to resolve the matter by email. Every single time the request was simply ignored. It was only subsequently working with vulnerability teams and banks that I learned they're not permitted to offer this. The silence had left us feeling either they were being malicious and ignoring us or incompetent, neither of those being a quality that you really look for in a bank. A simple, "I'm sorry, we can't do that because we're not allowed to," would have diffused all that negativity. It's upsetting, it's frustrating, it's traumatizing, but most of all, it's exhausting. And we're exhausted before we start. So what would a good disclosure experience look like? It would start with receiving the support we need, but it would go beyond that. Support would be given upon request. Ideally, that request would be built into the infrastructure of a platform, though I realize that's not always possible. But at the least, it should be given without questioning why, without asking intimate medical details, and without a hint of judgment. And beyond that, it should be remembered so we don't have to ask for the same thing the next time. Each poor experience through our lives makes it less likely that we'll disclose in the future. From the point of view of a firm trying to do the right thing, that will be frustrating, and I understand. But from our point of view on the other side, it makes sense on so many levels. Although we're passing up the chance of having the support we need, we're protecting ourselves from the threat of trauma or exhaustion. And from where we sit, the arithmetic seems very clear. Experience has told us disclosure rarely, if ever, ends with support. From your seat, you might shout, "Yes, but we're going to do it right if you would just tell us." But I would invite every firm, every enthusiastic vulnerability champion to undertake a very simple reflection. How many of the firms who failed us over the years would have been sitting where you are saying, "We're going to do it wrong"? Almost everyone who failed to provide help had good intentions. Almost everyone who traumatized us had good policies in place. So simply telling us you're different with your words risks conveying to us, unbeknownst to you, the message that actually you're the same. Thank you.
Thank you, Dan.
Sorry, and
really,
I realised that actually when I was shouting at the door, I was covering up my headphones, not the microphone, which is a very interesting reaction.
That's fine. I hope it went into your pigeonhole. We've all been there when you've been on one of these calls and somebody just will not stop knocking on the door, so don't worry about it at all. Thank you so much for sharing those experiences. There really is nothing that compares to hearing from people who have actually struggled on the other end of this system to really bring it home how important it is to get it right. And also, such an important point that good intentions are good, and it is good to have good intentions, but they don't always mean good outcomes, and being realistic about that is really important. So thank you, Dan, and also for your work feeding into those guides as well. I should say at Money and Mental Health, so some of you will have worked with us through our research work, some of you will have worked with us through our more practical hands-on work with firms. So as well as turning the research into guides like these today and best practice resources that are on our website, we also come and work hands-on with firms to get a kind of practical understanding of how we can help you to do some of this stuff. If anybody would like to have a conversation with us about disclosure or about other areas where we can help to improve outcomes for customers with mental health problems, we're really keen to do that. I just wanted to very briefly introduce the newest member of our team to you, Rosie, who I'm sure will pop up on screen in a minute, but if not, you can spot her on the call. Rosie is our head of strategic partnerships and runs our mental health accessible work. Do you want to say hello, Rosie?
Hi, everyone. Nice to see you all. If anyone is interested in learning a bit more about the work we do on the mental health accessible program, then please do shoot me an email after the event. I'll make sure that my email is included on the post-event email. Hopefully speak to some of you soon. Helen, you're still on mute.
Thank you. I wanted to introduce Rosie because I didn't want to drop her in it and ask her to speak, because she did start with us 3 weeks ago. But I think it is nice to see a face so that when you follow up afterwards, you know who you're talking to. Right, so we're about to go into our breakout sessions. You'll be sent automatically into small breakout rooms. I think they're randomly assigned, but there should be a member of the Money and Mental Health team in each. So feel free to ask them any questions and they'll just be guiding us on our discussion question. But I wanted to share with you the results from our poll. So the question was, what is the biggest challenge essential service providers face in improving their disclosure process? And well, there's a mixed set of views, but there is a clear front runner. So a lack of understanding on how to encourage and support people to disclose is top at 37%. Next came uncertainty about what support customers want when they do disclose. And then close behind that was a lack of capacity to respond appropriately when customers do disclose. And then a bit lower down was concerns about how to record customers' disclosure, which was only 15%. So I'm glad that one isn't up at the top, that worrying about recording data is stopping people from asking the question too often, although 15% is still a reasonable number of people. So that's where we're going to start with our discussion, is where you think the biggest challenges face. What is the challenge for your organisation that you're struggling with at the moment? So we're going to go into the breakout sessions now. We will only be in there for about 10 minutes because I want to make sure we've got plenty of time for our panel discussion and for Q&A as well. And you'll be pulled back through automatically into the main meeting afterwards. So yeah, team, please do send us to the breakouts and we will see you in a minute. There were a couple of things that came up in our discussion that made me think actually it might be useful to pop a couple of resources in the chat. So if people in the Money and Mental Health team wouldn't mind helping me out by popping a couple of those in there. One is our Need to Know guide, which we also collaborated with Chris on. And we had a conversation in our group about the challenge sometimes when people disclose, knowing what kind of help and support might be useful, and customers don't always know what kind of help and support might be available or useful either. Our Need to Know guide gives you a bit of an in-depth look at a wide range of different mental health conditions and how they might affect financial capability or our ability to navigate and communicate with services and the sorts of things that might help. So it's a really practical guide for those working in particularly customer services teams. So we can pop that in there. And also our work on the Equality Act, where we did a piece of work that mapped out the sorts of reasonable adjustments that people with mental health problems told us would be useful to help them to have equal access to services under the Equality Act. So if we could pop both of those in the chat, I think they would be really useful guides for people. Great. We're going to go over to our panel discussion. We have got 35 minutes left. I want to make sure we have plenty of time for Q&A, and I did say that I'd go to an opening question to our panelists first. So panelists, if I can ask you to please keep your responses relatively short, that would be really helpful so that we make sure that we have time for Q&A. And if you'd like to ask questions, please do pop them in the chat box on Zoom, and the earlier you get your questions in, the better, and we'll try and answer as many as we can. So Charlotte, coming over to you, you were going to reflect a bit on how the guides reflect your experiences and those of the vulnerability team at O2. We focused a little bit more on the financial services industry so far, but obviously this is relevant right across all essential services. So I'm really keen to hear how this carries across to your work.
Yeah, okay. So to be fair, well, I wish they'd have been around when we were implementing our specialist team, because they are incredibly helpful and do, like Catherine said, cover a lot of the key challenges. So they're not a million miles away, but they're aligned a lot to the Ofcom. We're a dual regulated firm, so we've got the FCA and Ofcom guidance, which they're very much aligned with. In terms of disclosure, I think, you know, we're probably in a pretty good place because we've got the benefits of being a multi-channel business. So, you know, if somebody doesn't want to disclose verbally, they can do it via an online form. They can actually pop into a store and talk to somebody via any of our channels. I think in terms of disclosure, I think one of the main things is about the relevance around the support that you can offer a customer once they do disclose. And I think we pretty much got it nailed in O2, but reading the guide, I think there's more we can do, and I was scribbling things and improvements that we could make. The treatment matrix, I think, is a fantastic idea, because some of our agents struggle with customers asking, because then it's okay, so if they do disclose, what's the support that I can offer? And although a treatment matrix is fantastic, I think it's just that important about, if you want to understand what the customer wants, you just ask them. So we're on a journey, and I think we're in a really good place on O2. But as you know, we've recently merged with Virgin, and they've got a very different approach. So I've got the joy of being able to implement that strategy again and learn. And I think in terms of the guidance, there's some brilliant stuff around customers' experiences that we can use rolling out that training. And yeah, so yeah, it's pretty much aligned and very incredibly helpful. There's nothing in there that's not helpful.
Thank you very much, Charlotte. That's really good to hear, and good to hear that you went into it thinking it was good, but there was already some stuff to take away. So that's exactly what I want to hear. That was really nice. Catherine, I'm going to come back to you and see if we can hear you a little better. Are you there?
Yeah, is that any better?
That does seem a lot better to me, yeah, and we're getting some thumbs up on the call. Thank you. So yes, so you were...
iPad, that's all I will say.
That's fine, thank you. So you were giving some reflections on the guides based on your experiences at Lloyds. I caught some of what you're saying, but do feel free to start again, because I think some people didn't quite catch the beginning either.
Yeah, no, I think the comment in the first guide about disclosure and the fact that we've got to actually be able to train the colleagues so that they can actually spot what the need is, because actually customers don't understand that. And we certainly get that in the financial industry from that point of view. In the second guide, the use of scripts as well was really interesting, and the use of Texas and some of the models. So I think, again, if you were starting out and you were looking at what, you know, how could you help colleagues to understand it, then definitely Texas is a really good model to use. Having said that, and building on some of the comments from earlier on from Dan, etc., we actually have found that we're trying to move away from Texas now, because it feels too much like a script. And actually, by the thought that somebody's just reading a script actually stops customers from disclosing. So there's pluses and minuses, and I think it's a journey that you go on from that point of view. And then the recording disclosure, the third one, the big issue for us is we sometimes find that we have an amazing conversation with a customer, and we're all very happy about what we want them to disclose, etc. And then we try to explain to them how we're going to use the data. And that actually quite scares them. and you tend to find that you get loads of customers who have been really happy and then suddenly say, oh no, I don't want this data shared with anyone else. But I don't think it's from an understanding of what that data is going to be used for. So I think that's one that we still need to, I think, work through from what do we need to do from a regulatory and a GDPR point of view, and how do you explain it to somebody really simply?
Thank you very much, Catherine. That's really, really helpful. I hope the third guide will be useful on some of that. That also resonates with the conversation that we had in our breakout room, where it felt like there are quite different interpretations of what is allowed in terms of recording vulnerability data as well. So as a starting point, I hope the guide is helpful at getting us kind of on the same page around how we start, but also what customers want that conversation to look like. But you're right, explaining it in a way that is accurate but also understandable is a real challenge. So Dan, I'm going to come back to you now, and I wanted to ask you specifically about your view on what you feel makes for a good disclosure environment and how this ties with your broader relationship with a firm that might go beyond that disclosure moment.
So I think actually, as this has been touched on by Conor and Chris as well, that it's about not just saying something but doing it. So it's the classic sort of deeds not words, and that's something I think that it's important to realize isn't just what happens after disclosure but what's happened before disclosure. So it's about how your relationship is from day one, which can be difficult to hear because most people's day one has come and gone. It is clawbackable, but really this is, and I think it's the same for any relationship, that the key moment in any relationship is the first moment, because that's when you can make or break trust. So your relationship to new customers, not necessarily around something to do with disclosure, but just the way you treat people and demonstrating through your actions that you are someone who will follow up. So one of the things I sort of put in an aphorism is, what matters when you're talking about mental health is what you say when you're not talking about mental health, because all of those things illustrate and pre-build that relationship so that the customer knows that when it comes to the crunch point and they make that disclosure, you are likely then to listen and to implement. So it's all the things you do, as I say, when you're not talking about mental health, when you're just building the relationship, that will put us in a position where we're more likely to disclose.
Thank you very much, Dan. I think that's such an important point, and it is hard to hear because it does relate to things that have happened in the past, but also a lot of opportunity for the future, because hopefully there's lots of new customers coming on board every day, and we can start from scratch with those people and think ambitiously about how we create an environment for them now that will support them if they needed to disclose at some point in the future. Thanks, Dan. And actually on that note, Conor, I'm going to come to you with a question about the cost of living crisis, because there will be lots of people who are potentially facing difficulty now who have not been in the past. Would you be able to tell us a little bit about a bit of context on how that crisis is affecting people and what that means for the issues that we're discussing today?
Sure, and I think there's probably two strands to this. There's the effect that most of us are going through, where finances are that bit tighter, and that is putting some of those difficult decisions that I mentioned in my opening comments are affecting lots of people. So there may be some people who've never had an issue with their mental health before who are now struggling that bit more. And when we did some polling on this back in the summer, we heard from lots of people who felt either anxious or depressed or unable to cope. We heard from about 1 in 5 people said they felt unable to cope due to the rise in the cost of living in the previous months. And we're going to do a new polling exercise on that in the next couple of days. And unfortunately, I would expect that to be a bit higher. So there's that general populace who haven't struggled before, where those initial conversations, the first time is almost there for them. That there's a big opportunity potentially for people who are getting in touch with their firms, or when firms are messaging around. If you're worried about your financial situation, there's a really key moment here. I suppose the other group that we then do focus on are people with pre-existing conditions. And as I said, the impact on them as a group has been harder, I would say, or harsher than for the rest of the population. So again, that's why it's so important that getting the support, getting this right as quickly as possible can help people to really deal with what can be some really, really tough times, unfortunately. And I think, to pick one example, we've just done some bit of research with our research community on the energy vouchers and the energy support schemes, and even that with something that should seem like it should be fairly straightforward, where it's just directly giving people help, where firms have good news basically to impart. There's still lots of problems where messaging hasn't been clear, where expectations around people with prepayment meters, where they need to go to the post office and the post office is miles away from them, and the person who cares for them and helps them out with their errands isn't able to get there during their lunch break when they have it. So there's just really loads of elements here where getting the support that is available to people will get just that much smoother if disclosures are handled well and the right needs are identified and supported.
Thank you, Conor. And an important point there as well, that while we're focused on disclosure of mental health problems here, lots of the things that we're talking about would also support people disclosing a range of other needs or kind of vulnerabilities that might be affecting them in their lives more broadly. Chris, I'm going to come to you with a question, and then we've had some great questions coming in on the chat, so I'm going to put those to the panel next. Please do keep coming with your questions and we'll get to as many of them as we can. Chris, my question to you is, could you tell us a little bit more about some of the considerations that firms need to weigh up when recording data about disclosure, how they can ensure that they're enabling as well as meeting GDPR requirements? This is something that came up in our chat, as I'm sure it did in a few, and that Catherine mentioned as well, so I know it's on people's minds on the call.
Okay, no, that's so very quickly, two things. Minimum of the most relevant data for meaningful action support should be recorded, so we need to know what's relevant and what support we can offer. Dan's point about actions, not just words. The second thing is, and this is the one where there is debate at the moment, is who decides whether this can be recorded, the consumer or the firm. So on one hand, you've got explicit consent as a lawful processing basis. There are many. You've got explicit consent where the consumer chooses, they can refuse, they can withdraw consent, they arguably have more control. On the other hand, there is an option under substantial public interest for firms to record health data without explicit consent, but under certain circumstances where consent can't be given, you can't obtain consent. Well, here's the googly for us to unpick, where getting consent would prejudice a firm's ability to protect the customer's economic well-being. And this is where it's flamed into a discussion, because people have different interpretations and definitions of what would actually be a circumstance where a firm would need to protect a customer's economic well-being, and getting consent would impinge on that. And my concern or my challenge to my colleagues is, we often have these discussions about lawful processing bases, data protection strategies with your data protection officer, legal and compliance, maybe someone from vulnerability team, but the consumer's not in the room. So one of the reasons why we wanted to do this research, Money, Mental Health and Money Advice Trust, was to allow consumers to start talking about what they would like from disclosure, how they would like that disclosure to happen, and what controls they would like. Because if we start to record these data, and even if we offer an opportunity for the consumer to object, we can still override that as a firm if we use legitimate interest as our Article 6 processing base, one for the geeks there. So we need to have this discussion about what is possible, because actually, when the word's out, actually firms are now, they can override your objections, and it solves you a short-term problem. It's another barrier to disclosure. So I'm not saying it's not possible. Some firms have got some great checks and balances in place, but it needs to be explored. If you're interested in more, look at the guide, but also look at the GDPR and vulnerability guide, which is in 4 volumes, not just 3, Helen. So Malg and Money Advice Trust.
Chris, is that 4 volumes just on GDPR?
Yeah, I know you seem excited by that, Helen. Yeah, it's like Christmas coming up, so everybody do stock up. It's
seriously though, Chris's level of knowledge and expertise on this is pretty much unparalleled, so do have a look at those, because they will be really useful to you. I am going to jump into the questions that are coming in on the chat. Panelists, I'm not going to come to every panelist on every question because otherwise we won't have time to get through many questions. But please do jump in if when I ask a question there's one that you particularly want to answer, or I will pick on people if we haven't heard enough from everyone. So first question has come through from Naki from Barclays. Apologies if I've pronounced your name incorrectly there. And they say, I'd like to hear from our panelists on how best they deal with different conditions which can't be quantified due to mental health being such a large spectrum. So I think that's where you don't necessarily know the name of a condition or couldn't record the name of a condition, and then to come up with the most appropriate response, especially when in a digital solution. And they say they found the same issue with mental capacity, which they're working on right now. Does anybody want to kick us off with a response to that?
I'm happy to, if you like. Oh, sorry, Catherine, go on. Okay, we've kind of got a two-tier support model at O2. So if it's reasonable adjustments and just basic tweaks that we need to make to how we support somebody, they can be supported in front line, but we have a specialist team, so it's a small ring-fenced team who have access to more detailed information about a customer's support needs. So it doesn't necessarily have to fit into a category. It's more conversational. So frontline would make the referral, then a more detailed conversation would happen with the customer about, okay, so what is it that you need us to do differently? So there's some high-level categorization to help us with capacity planning, etc. But behind that, there's a free text field. So it may well be that if somebody, part of their condition means they get aggressive, we'd know when to contact that team, that that's just part of the condition and it's not an aggression aimed at them. So it's just having that additional information available just to a smaller pool of people. And we do, it's explicit consent, by the way. We don't record what we think. It's consent from the customer.
Thank you, Charlotte. Catherine, were you coming in at the same time there?
Yes. So we look at it in two ways. One, similar to a lot of other people, we focus on what's the support that's required. So we always record what's the support need, as opposed to trying to work out what's the correct terminology that somebody should actually write down or record. And then the other thing that we've developed is a colleague support tool. So we've used AI to be able to constantly keep checking so that you as a colleague can just literally type in whatever it is that the customer's just said to you, and it will then work through and try and find what's the response, what's the support that we can actually provide. And that's been just a complete change, seeing a sea change in giving colleagues the confidence almost to start talking, because they know that they can very quickly find. We continually keep updating it all the time so that people are actually using the customers use as well.
Sorry. Thank you very much. That's really, really useful. Is there anyone else who wants to come in on that question, or shall we move on to the next one? Great. I think lots of people would have been saying similar things about recording support needs there, because that's been a real theme that's come up in our guides as well. The next question that I'm going to draw on here says they're interested in views from the panel on how we manage disclosure on an ongoing basis. So this is a really key one, and we did discuss this again in our breakout group, is that particularly mental health problems often fluctuate. So how do we make sure that the information that we're recording and the appropriate response that's needed is kept up to date? Does anybody have any views or experience on that one that they wanted to share?
So again, Helen, we are trying to identify which of the support needs that we need to go back in every 12 months, every 6 months, etc., so that it actually gives a prompt to the colleague to actually ask the question. So it won't be for them all, but we've also got some support needs that we would actually flag and say, we're actually going to remove this at the moment unless you can confirm that this is still the same position as well. So, but that's us just testing and learning constantly and understanding which are the ones that we need to do that with.
I think, Helen, sorry, Helen, I was just going to say, I think there are things that firms will want to do to ensure their data is accurate, relevant and timely. I think it's about how easy is it for me as an individual to do that when I want to do it. Because if I tell you something is permanent, then I probably don't want a reminder every 6 months that what I've told you that's permanent is it needs to be updated. I mean, sight loss is the obvious one, but there are many corollaries with mental health as well, which we might want in place. I think, how easy is it for me as a consumer as well to do this, and what's the incentive, and what's that corporate term, value exchange, that always pops up? You know, what's the benefit for me of doing this? So it's really tricky, and it's easy for us to make recommendations what firms can do, but I know for organisations making these systems changes, it's about turning the oil tanker around. And I'm sure Catherine and Charlotte and others on the call will be right. Actually, we need to test and learn. We need to involve consumers in this to ensure that this is being taken in the right way.
Thank you, Chris. Yeah, really important point. There will be cases where the answer here is just to ask people when they disclose, and maybe building that into conversations and asking whether this is something that affects them on a long-term basis, or whether it's short-term, and when it would be useful to check in to update that information might be part of a helpful disclosure conversation. I'm going to move on to the next question just because I want to get through as many as we can. We've got a question from Paul Heimers who says, I'm interested in the panel's view on disclosure across different demographic groups. I'm so pleased that somebody has asked this, because this is something that we didn't have the space to get into in the guides, but is something that we've been thinking about. So how we adapt to the person in front of us. So for example, they've raised some of the different attitudes to cancer disclosure that affect different religious or cultural groups. I'm going to come to Conor first and pick on you, because I know this is something that we have actually done some research on, so you might have some insights to share, and then I'll open it up to anybody else who wants to contribute. So Conor.
Thanks. One of the reasons we did that big polling exercise that we've mentioned already of 5,000 people was so that we could look at some of the different experiences of different groups and who's less likely or more likely to disclose. And I think the barriers, again, different. We heard from, been doing a series of work on demographics using that data, and I think we found from older people, there's sometimes less of an expectation that older people will have mental health problems. It doesn't get brought up with them as much, so those opportunities are missed. I think with younger people, sometimes it's felt like it's going to be an easier conversation, or people will just feel more comfortable discussing it, and sometimes they get the benefit of that. I think broadly, I think what we were just speaking about, treating people as individuals, trying to understand what they want first and foremost, is the best way to approach this, and not seeing someone as fitting specifically into one group or another. I think there's something on training for staff who are responding to that, to try and understand where there might be, I think, opportunities to better understand the approaches that people have, or the thoughts that people might be approaching the disclosure discussion with, talking to people who are directly involved in these things. So if, to pick the cancer example, I'm sure Macmillan would be very happy to go and speak to firms about how to understand some of the specific aspects that they might want to consider with that. And then I think there's probably an opportunity around data as well, just to look at, within your customer base, thinking about the fact that we do have around 1 in 4 people at any one time who have a mental health problem. How does that stack up with your data? Where are there potentially groups who are being underserved by your current approach? And is there things that you could adapt or change that might better serve their needs?
Thank you, Conor. I should say we are doing a more in-depth look at ethnicity and money and mental health at the moment. That's due out early next year, and so you can expect a deeper look at that coming soon. Our paper on age is coming out just before Christmas, and one of the things that really stood out for me, so we also published a paper on gender just a couple of months ago, is, and I hope I get this right, Conor, you can pull faces at me if I get it slightly wrong, but that women and older people also reported less positive experiences after disclosure. So as well as those kind of demographic factors affecting our experience of whether we disclose, women reported that they felt they were less likely to be taken seriously and offered meaningful support in response to a disclosure, and the same with older people. So thinking both about how we encourage disclosure, but also what preconceptions and biases we might be bringing to a conversation that might affect the kind of help and support that we would offer to someone following a disclosure as well. Did anybody else want to come in on that question? No. Then I'm going to...
Dan has his hand up. I don't know if you can see.
Sorry, thank you. I couldn't
sorry,
see that.
can you not see me? Sorry, I thought.
That's all right. Over to you, Dan.
No, I was going to come in on the importance again of the wider context of a firm's messaging, and how this will be reflected in whether people choose to disclose or not. Also thinking about communities who feel particularly marginalised. So, for example, the trans community who may not want to have close contact with a bank at all because they may feel that the moment their trans identity is out there as part of the conversation, that will in itself lead to less favourable treatment, even if not institutionally, then amongst individuals. So it's how banks train their individual staff who may have particular views that mean that people are going to be uncomfortable disclosing to them. And this isn't just a demographic thing, but this whole question of consistency is something that I think needs to be really addressed, so that I know that I'll get the same experience whoever I speak to within a firm.
Thank you, Dan. Really, really important points. I'm going to come on to, so I've got 2 more questions that have come in on the chat, and I think we can manage to do both of them. We've got 7 minutes, so I think we can manage to get through both of them. So we've got a question from Tom Doidge at Capital One. So Tom says, how important do we feel it is for organisations to leverage specialist support functions to effectively manage disclosures and support needs? And it's interested to hear thoughts about how this might differ for firms of larger or smaller scale, and also making sure that meeting vulnerable customer needs is properly embedded and isn't someone else's responsibility. Such an important question, and this is something that we've grappled with through our mental health accessible work, as we've worked with large and small firms. And when we look at training strategies and where you equip your teams, whether you do really in-depth training for a specialist support team and then light touch training everywhere else and focus on referral in, or whether you try and get broader training across everybody and make it that every single contact is with somebody who's well trained, is definitely a very live question for lots of firms. Would anybody like to come straight back in on that question?
I'm happy to have we've tried all the approaches, if I'm honest. We're learning all the time. So we've had Virgin Media side of the business. They support everybody in frontline and everybody gets specialist training, but they're struggling with some of the more complex stuff. Whereas on O2, everybody gets a basic level of training. Then we've got the specialist support team who have got access to more ways to communicate with customers, and they've had additional training by, mental health awareness and on autism, all sorts of additional training. We find that approach works for us, especially because we've got offshore partners who support our customers, and what's vulnerable in this country might be different to another, and it's really hard to so we found that works for us. As we implement in what we've learned in Virgin Media, we are going to move to a similar support model. So it depends, what the level of support is, what you need. If it's really specialist, we're gonna grow our support team.
Thank you very much, Charlotte. That's really useful to hear. Did anybody else want to come in on that question?
Yeah, I can come in there. I'll go on there. Go.
No, I was sorry. I was just going to point out the disadvantage with having specialist teams is that it's another step. For someone who might be struggling to take one step, then a referral is an additional step in the journey for us. And also, to come back to the business case, support isn't just an issue when we're in trouble. So we need help whether we're in trouble or not. So often, specialist training can be limited to those people who deal with us when we're in difficulty, rather than those people who deal with our day-to-day interactions. And that sort of feels like it's both missing a trick and making it more likely that we get into difficulty.
I was just going to simply add, Helen, that 2 things to consider. One is you don't want to create a bottleneck into your specialist support team because the rest of the organisation thinks, phew, there's now somewhere I can send Chris or Conor or Catherine. Now they've come through. So that's never in your intentions designs, but it always happens unless you orientate the rest of the organisation. So where I've seen, and the second point is where I've seen this happen most effectively, is where the specialists truly are specialists, dealing with the most complex, the most difficult, the most enduring levels of support need that require that additional insight, maybe about conditions, but also a wider range of options and permissions to support the customer, but where frontline, be it branch, web chat, telephone, are able to allow the customer, as Dan said right at the start of this piece, to get on with their life by doing what they need to do in a way that works for them. And I've seen that work really well in a number of places. So yeah.
Thank you very much, Chris. That's really helpful. We've only got 3 minutes left. I am going to attempt to do a final question, but because I think it's a really important one at the moment, it's come up twice, which is about the support that's available for staff. So there are two human beings involved in a disclosure conversation, and we should recognise that it can be difficult for staff members to listen to distressing stories or kind of particularly things that they can relate to personally. I'm going to come very quickly to Charlotte and Catherine, because I'd love to hear a little bit about what's in place in your organisations, what support is available, and then if anybody else wants to make a final comment on that before we wrap up, you'd be very welcome to. Charlotte or Catherine, do either of you want to come in on that?
I'll let Catherine go first for a change. Go on.
Okay, so yes, we do provide support to our colleagues. We actually provide it through a third party. And people can request it, and the line manager doesn't need to know. So it's not something that they have to sit there and declare. We also, dependent on, there will obviously be certain teams that you just know are going to get the worst calls possible. And so we try and make sure that they've got some very structured support and they understand where to go to get that. But I think nowadays, anybody who talks to it in any customer-facing area has got the opportunity to come across the most horrific experience. And so we've broadened that, and we literally have a telephone number that somebody can ring and they know they will get the right support. We've had some amazing results from that. So yeah, we could share who we work with, etc., from that side of things. But yeah, it needs to be there definitely, because it is becoming, you know, being customer facing now is becoming quite a difficult task.
Yeah, and in O2 and Virgin Media, we've got like occupational health, so you can refer and get specialist help if you really need it. But within the specialist teams, the team leaders are, you know, they've been put into that role because of the way that they support. We have had people who've moved off the team because they've been maybe going through things in their own life and it's just not right for them anymore. So there's various options. Just downtime, it's a bit of downtime after a difficult call. So yeah, there's just a bit of everything really, but it is tricky, and we're seeing more of it, especially now people are answering some of those calls in their own homes.
Yeah, just to add very, very quickly, I've seen burnout happen amongst staff, often in organisations where they're unable to support the customer. So they well, thank you for telling me that, but there doesn't seem anything they can do to help. So where support or signposting strategies are clearer, I think that arguably could be a protective factor as well.
Thank you, Chris. And yeah, important to hear that actually getting this right for customers is good for staff as well, and having that clarity about what you can do is really helpful. I am going to wrap up unless anybody else has got their hand up, because I can't quite see. No, great. Because I'm keen for us to finish on time, particularly because I'm sure it is lunchtime for most people. It's been so nice to see you all here today, and I'm so pleased that we could fit so many of you in, and the quality of the conversation and the questions has just been so rich. I've certainly taken an awful lot away from it. We have recorded the session today, and we will be sharing that on our website, as well as I'm sure emailing around the resources and some links as well. Please do share it with your colleagues if you think they'd find it useful, and take a look at the guides as well. And I should say again, if you'd like to have a conversation about more practical help and support that we can offer, either with disclosure or more broadly with outcomes for people with mental health problems, please do drop Rosie a line. She'll pop her email address in the chat, or get in touch with any of us, because we would love to talk to you more about it. And also, please do sign up to our professional network. So if you go on the Money and Mental Health website and click join in, you can join our professional network. I'm sure somebody will share a link in the chat to that as well. It's a fancy name for a mailing list, but it does mean that you get invited to all of our future events, and you're the first one to receive our publications as well, so we can make sure that we keep sharing our information and resources with you on an ongoing basis. So thank you for joining us. Really lovely to see you, and we hope that we will see you next time. Take care.